Good afternoon, everybody, and my name is Adrian Harris, and I'm here to present my project. The name of my presentation is Assessing the Risk for an Increased Chance of Acute Heart Failure in Patients Who Have Suffered from an Infection from COVID-19. So just to start off with a little bit of definitions, a lot of people already know what COVID-19 is, but a little broader, not a broader, but a little bit condensed definition of it would be an infectious disease caused by the SARS-CoV-2 virus, and some of the symptoms of that include pain or pressure in the chest, chills, frequent coughing, shortness of breath, and fatigue. So the other thing I want to talk about today is acute heart failure, and in this research presentation, I correlated the two between them having an effect on each other, one having an effect on one another. So a little short definition for acute heart failure would be a condition in which the heart isn't able to get pumping up blood to the areas of the body it needs to. Some of those symptoms are kind of similar to that of COVID-19. They include shortness of breath, fatigue, and rapid heartbeat. So for my first article number 1, the title of it was The Impact of COVID-19 on Heart Failure, Hospitalization, and Management Report from a heart failure unit in London during the peak of the pandemic. So I decided to take a look at COVID-19 overseas because I know it had a tremendous effect over there, and just see how that played a role over there. So a little bit of the intro for that first article. Severity of acute heart failure. It was very, very intense over there, and heart failure usually causes immediate admission to the hospital, no matter what. And with COVID-19 going on, a lot of people weren't able to get in and stuff like that. So COVID-19 was a high burden to healthcare systems because it was hard to manage the amount of people coming, and not everybody was able to do normal treatments due to masks and mandates and everything like that. And they were pretty strict over there. I know probably not as strict as the U.S. was or needed to be at first, or just in general, really. And with London already being such a big population, it was already the highest COVID-19 cases in the UK, so that caused even more problems for the amount of people able to get into the hospitals and stuff like that. So from the author's hypothesis, he said that there would be the acute heart failure hospitalization would decline during the pandemic, and follow-ups will be worse. So we got to dive into that and take a look at that later on in the study. So some of the methods that they did were they took some numbers of consecutive patients, and what it started from the coronavirus death in the first one in England, and compared it all the way up to about April 19, and compared that to like past data of patients with acute heart failure, and see how they compared. And they took a look at the hospital admissions with a diagnosis of heart failure in the second position to see whether patients were admitted with acute heart failure or was it secondary to COVID-19. So taking a look at this first chart right here, this is a look at the weekly admissions for heart failure pre and post COVID-19. So as we're looking at this right now, starting in 2017, about a little up there to the tens, and then 2018 you see a rise. 2019 you see a rise just like right before COVID happens. And then 2020, right before COVID happens, pre-COVID, you see that. And then you see a dramatic drop right after post-COVID in 2020. So that's something to look at. This right here is a little statistical analysis of the trends of number of the hospitalization rates. You can see the trends of heart failure by year. So you can see during the first UK death from COVID-19, the Hospitalization was pretty high in 2019. And then compared to that of 2020, during that same time of year, you can see a dramatic drop. And as we go down to the lockdown, another key point on it, we can see that the hospitalization was pretty high, and it takes another dramatic drop back in 2020 years compared to the same date. And you see both of those. You kind of see those correlations between all of the dates, whether it be from 2019 or 2020. And you can see that the trend of hospitalizations in 2019 kind of stayed a little bit steady, but it was a dramatic decrease in 2020. So from the conclusion, we can see that the article was correct and that COVID-19 didn't have a direct effect on the number of patients attaining and dying from heart failure caused by COVID-19, increasing its fatalities. We see that in the decline right here. We see that in the decline right here of the amount of hospitalizations from 2019 compared to 2020 and a little bit after the pandemic. But further things are needed to truly correlate that too. This just could have been something that just happened, but I feel like more information is needed, and the author does too, to look at that. So a little discussion. Little was known about COVID-19 and its effects of the admission of patients with acute heart failure. Significant decline in hospitalization rates was noted during the pandemic compared to previous years. Why do we think this? It could be maybe because people are scared to go out their houses due to COVID-19 being such a scary time. I know, like, when COVID-19 came on TV and I just heard about it, and I was like, it can be a kind of scary thing. A lot of people didn't want to leave their houses because they were scared of contracting this virus and dying, and you saw lots of deaths from COVID-19. And then maybe the lockdown played a role. I know a lot of places had strict lockdowns. We didn't really have strict lockdowns at first, or Americans didn't really follow as well, but maybe a strict lockdown could have played a role into the decrease in the hospitalization. And maybe even they didn't really have a severe acute heart failure that needed to be attended to, so that maybe played a role as well. So for my second article, Heart Failure in COVID-19 Patients, the title of it is Heart Failure in COVID-19 Patients, the Prevalence, the Incident, and the Prognosis Implications. The introduction. So a little bit to talk about the second article. COVID-19 caused a catastrophic amount of mortality around the globe, as you know, with the increasing numbers of deaths that we experienced. And cardiovascular diseases and cardiovascular risk factors are common comorbidities in COVID-19 patients and have been associated with poor outcomes. Those two things right there can just be two deadly combos that can lead to very severe sickness or even death. Many believe that COVID-19 triggered acute heart failure, and this article kind of took a look at that. It examined some of the cardiovascular outcomes and mortality rates in patients with COVID-19 and a prior diagnosis of heart failure. So some of the methods, they kind of did the same thing, but this study was based off in Spain instead of London. So they looked at it from March 1st to April 20th of 2020. Patients were screened, and they used the RNA reverse transcriptase polymers chain reaction assay from the nasopharyngeal swab specimens, and they took those from confirmed COVID-19 patients. Then they had 13 cardiologists take a look at the demographic, the clinical, the laboratory, all of the data, all of the medical records that they found from COVID-19 patients, and examine it to exactly get a good look at it. Looking here at the first chart, it is a comparison of patients with vascular heart failure and those without it. So as you can see, it takes a look at the mortality percentage, and they both start pretty good, but as the days from the diagnosis goes on and more, you see a dramatic drop in the survival. And that's you can see that in the tables. This right here is a baseline characteristic of all the things that's going on between the patients. So they had about 3,080 patients in all. Out of those, we had 2,928 that were non-affected by acute heart failure, and we had 152 that were. So we look at the bottom and we look at the deaths, and we see that 36 out of, not 36, you see that 74 out of 152 patients experienced deaths, and that's nearly half, which is a pretty big amount compared to only 19% of people without it that experienced it. And you really can't just say that with all the things of hypertension and diabetes and other diseases and disorders that were accounted for. You can't really see that COVID-19 and the heart had a direct effect on the heart failure of these people, but it's something to look at and something to think about when it's such a high amount in a comparison of all the COVID-19 patients. In conclusion, patients have a significant incidence of acute heart failure associated with poor outcomes. They also are high risk for COVID-19 for decompensation after COVID-19 diagnosis. As we look, just a very high death rate in those with acute heart failure. So a little bit of a relation to it between the two articles. Article 1, it examined the impact of COVID-19 on acute heart failure hospitalization rates and took a look at that. And Article 2, it kind of looked at the people who had heart failure prior diagnosis before and had COVID-19 and looked at the deaths and stuff like that. So both articles had hypotheses stating that COVID-19 would be a factor in the severity of heart failure in patients when affected by the virus as well. But they differ in the point to where one article discussed that COVID-19 had significant incidence of acute heart failure, while the other stated that acute heart failure hospitalizations declined. So it's really just, maybe it was just the different regions they were in, but we both came with two sides of the story from both articles. That's what we came to find. So my thoughts are, I thought that maybe they did a really great job at looking at the medical records and the effects of COVID-19 on heart failure. And I believe that the locations may have been a big factor in why the severity of COVID-19 adds, or how it adds to acute heart failure. Because maybe Spain and London were at two different points of views of what the lockdowns needed to be and how they needed to control COVID or anything like that, and just other diseases that played a role in that country. They might have some diseases that London doesn't have, and that probably played a big role into why we had two different answers or two different spectrums of the effects of COVID-19 on acute heart failure. And that's all I have, and these are some of my references, and thank you.